Did you know that aspirin, one of the most widely used medications worldwide, has its origins in willow bark, a remedy used by ancient civilizations for pain and fever? Indeed, the story of aspirin begins thousands of years ago, with both ancient Egyptians and Greeks utilizing willow bark for its medicinal properties. These early civilizations weren't aware of the scientific details, but they recognized the bark's effectiveness in alleviating pain and reducing fever. Fast forward to the 19th century when a chemist named Felix Hoffmann, working at Bayer, synthesized acetylsalicylic acid, the active ingredient in aspirin. Hoffmann was striving to find a less irritating substitute for salicylic acid, a similar compound also derived from willow bark, which was known for its medicinal benefits but had a tendency to upset the stomach. His successful synthesis marked the beginning of aspirin as we know it today, a staple in medicine cabinets around the globe. So the next time you pop an aspirin, remember you're using a remedy that stood the test of time. Aspirin is a salicylate, a type of compound that has a variety of effects on the body. This humble pill, found in medicine cabinets across the globe, works in a rather fascinating way. It targets and reduces certain substances in the body responsible for causing pain, fever, and inflammation. This is why aspirin has been a go-to remedy for headaches and minor pains for over a century. But that's not all. Aspirin also plays a significant role in cardiovascular health. It is often used to prevent heart attacks, strokes, and chest pain. It does this by inhibiting the production of a substance called thromboxane, which causes platelets in the blood to clump together. By preventing this clumping, aspirin reduces the risk of blood clots, which can lead to heart attacks or strokes. However, it's important to remember that aspirin should only be used for cardiovascular conditions under the supervision of a healthcare professional. This is because, like all medications, aspirin comes with potential risks and side effects, which need to be weighed against its benefits. Aspirin also has its place in treating rheumatoid arthritis, osteoarthritis, systemic lupus erythematosus, and other rheumatologic conditions. In these cases, it works by stopping the production of substances that cause pain, swelling, and blood clots. Additionally, aspirin can be used to relieve mild to moderate pain and reduce fever. This is why it's often found in cold, allergy, and pain medications. In essence, aspirin is a multi-purpose medication with a wide range of uses. It's a testament to the power of scientific discovery and innovation that such a simple compound can have such far-reaching effects on our health and well-being. So the next time you reach for that bottle of aspirin, take a moment to appreciate the complex chemistry at work behind the scenes. Despite its many benefits, aspirin isn't for everyone. It's crucial to understand that aspirin, like any medication, isn't universally safe for all individuals. Certain health conditions and circumstances can make aspirin use potentially harmful, even dangerous. One of the primary contraindications for aspirin is a bleeding disorder or a recent history of stomach or intestinal bleeding. Aspirin works by reducing substances that cause inflammation and blood clotting in the body. However, for individuals with bleeding disorders, this can lead to an increased risk of bleeding. Allergies are another significant factor to consider. If you're allergic to non-steroidal anti-inflammatory drugs, or NSAIDs, you should avoid aspirin. An allergic reaction to aspirin can present in several ways, ranging from mild symptoms like hives and nasal congestion, to severe reactions like difficulty breathing and shock. If you suspect an allergic reaction to aspirin, seek emergency medical attention immediately. Age is another crucial consideration when it comes to aspirin use. It's strongly advised not to give aspirin to children or teenagers who have fever, flu symptoms, or chickenpox. The reason for this is a rare but serious condition called Reyes syndrome, which can cause severe brain and liver damage in children and teenagers. There's another group that should be cautious with aspirin use: those with a history of asthma attacks or severe allergic reactions to NSAIDs. Aspirin can trigger bronchospasm, a sudden constriction of the muscles in the walls of the bronchioles. This can lead to asthma attacks in susceptible individuals. Lastly, it's important to mention that aspirin should be avoided in certain scenarios. For example, if you're taking blood thinners or other salicylates, aspirin may interact with these medications, increasing your risk of bleeding. As with all medications, it's essential to use aspirin safely and appropriately. Always consult with a healthcare professional before starting or stopping aspirin to ensure it's the right decision for your health. So, how do you use aspirin safely, you may ask? It's all about following instructions and understanding how different forms of the medication work. Aspirin is a powerful tool in our medicinal arsenal. But like any tool, it must be used correctly to be both safe and effective. This begins with adhering to the directed usage on the label, or following your doctor's prescription. It's crucial not to adjust the dosage or duration of use without professional guidance. Using too little won't be effective, and using too much or for too long can lead to unwanted side effects and even an overdose. Now let's talk about the different forms of aspirin. If you're using chewable tablets, ensure you chew the tablet before swallowing. This allows for quicker absorption and faster relief. On the other hand, if you're using enteric-coated or delayed/extended release pills, it's a different story. These are designed to gradually release the medication, providing longer-lasting relief. Crushing, chewing, or breaking these pills disrupts this mechanism, leading to the immediate release of the entire dose, which can be harmful. So remember, swallow these pills whole for utmost safety. While taking aspirin, it's also important to avoid certain substances. For example, alcohol can increase the risk of stomach bleeding, and ibuprofen can interfere with aspirin's heart protective effects. So, lay off the booze and be cautious with other pain relievers. Lastly, keep in mind that many cold, allergy, and pain medications may contain aspirin or other NSAIDs. Always check the labels to avoid accidentally doubling up on these substances. Remember, when it comes to medications, more isn't always better. Using aspirin safely means following the guidelines, respecting its power, and understanding its nuances. Make these practices a habit, and you'll be well equipped to use aspirin effectively and safely. Like all medications, aspirin can have side effects and can interact with other medications. While it's an effective treatment for pain, fever, and inflammation, it's important to be aware of the potential downsides. One of the serious side effects you may encounter is a ringing sensation in your ears. This could be accompanied by confusion, and in more severe cases, hallucinations. Remember, these are not common side effects, but they do warrant immediate medical attention. Aspirin can also cause severe nausea or stomach pain. Again, these symptoms are not typical, but they're significant enough to stop usage and consult a healthcare professional. In some instances, aspirin may cause bloody or tarry stools, another serious side effect that requires immediate medical attention. It's also worth noting that a fever lasting longer than 3 days while using aspirin should be a cause for concern. This could indicate that the body is reacting adversely to the medication, or that the underlying condition being treated may be more severe than initially thought. Now let's talk about interactions. Aspirin may interact with certain medications, including blood thinners and other salicylates. This is why it's crucial to inform your healthcare provider about any medications you're currently taking, even those that seem harmless or unrelated. Interactions can lead to an increased risk of bleeding or other complications, so full disclosure is vital. To sum up, while aspirin is a widely used and effective medication, it can have serious side effects and interactions. Always be aware of potential risks, and don't hesitate to seek medical advice if you experience any unusual symptoms. Always inform your healthcare provider about any medications you're taking to avoid dangerous interactions. Aspirin is a powerful medication with a rich history and a wide range of uses. We've learned together that aspirin, beyond being a common household name, is a salicylate with potent abilities to reduce pain, fever, and inflammation. However, its use doesn't come without caution. It's contraindicated in certain conditions like bleeding disorders, and must be used under the supervision of a doctor for cardiovascular conditions. Using aspirin safely involves adhering to prescribed dosages, not crushing or opening certain types of tablets, and being aware of its presence in other over-the-counter medications. It's also important to remember that aspirin may cause side effects, and can interact with other substances, including alcohol and certain medications. From its unusual origins to its modern uses and the necessary precautions for its safe use, aspirin truly is a fascinating subject. If you enjoyed this deep dive into aspirin, make sure to subscribe to our RxPlained YouTube channel for more informative videos about the world of medicine.